A South African judge on Tuesday postponed until August the 19th the murder trial of global athletics star Oscar Pistorius, who has been charged with shooting dead his girlfriend Riva Steenkamp on Valentine's Day. The judge postponed the case after the athlete's lawyers asked for more time to prepare. Pistorius had to make his way through a crowd of photographers and reporters as he made his first formal public appearance since his release on bail in February. The double amputee athlete, nicknamed the Blade Runner for the prosthetics he used in competitions, has admitted shooting his girlfriend 4 times through a locked bathroom door at his home in an affluent Pretoria community. In pre-trial testimony, his lawyers told the court the shooting was a tragic mistake and Pistorius was acting in self-defense against what he thought was an intruder in his home. Prosecutors accuse him of premeditated murder for firing into the door, hitting Steenkamp in the head, hip and arm. Well, let's cross over to CCTV's Guy Henderson, who has been following the proceedings closely in Pretoria, South Africa. Guy, now the trial has been postponed, but what were the main highlights of the brief hearing?
Well, the main point of interest here for the huge crowds of gathering international media and the public was just really the very presence of Oscar Pistorius himself. He was much calmer in court this time around from what he was back in February, when obviously those very famous images of him breaking down and sobbing at times uncontrollably. Although even now he did appear at times to stare very vacantly into the distance, and we did see just signs of that clenched jaw, so clearly a very nervous Oscar Pistorius once again. Now, he also had to face the media arriving in court this time. Remember, last time he was in police custody, so he was whisked in through a back gate in a police vehicle. This time he had to walk in through the front door, so the media were able to go right up at his face, and really a barrage of media taking photographs and getting footage. During the very brief proceedings, just 20 minutes or so, the magistrates announced what many had already expected, which is this postponement, which both sides had agreed to. That means that the next court appearance will take place for Oscar Pistorius on the 19th of August, which is giving the state enough time to complete their investigation and build a case around it. The other thing that took up a good portion of this brief hearing was comments by the magistrate expressing concerns about the intense media coverage of this case. He said he was determined for this not to become a trial by the media, and called for the media to respect what he called the fountains of South African justice to take its toll.
All right, Guy Henderson in Pretoria, following the proceedings of the Oscar Pistorius trial there in South Africa. Now, in an unprecedented move, the United States on Monday posted up to $23 million in rewards to help track down 5 leaders of militant groups accused of spreading terror in West Africa. Umar Ul Hamaha, the spokesman for Mali's movement for oneness and jihad in West Africa, is among those targeted by the rewards program. Trevor Ombija reports.
The U.S. State Department's Rewards for Justice program targeted Al-Qaeda in the Islamic Maghreb, also known as AKIM, offering its first ever bounties for wanted militants in West Africa. Up to $5 million was posted for Al-Qaeda veteran Mokhtar Bil Mokhtar, the one-eyed Islamist behind the devastating attack on an Algerian gas plant in January, in which 37 foreigners, including 3 Americans, were killed. A further $5 million was offered for top AKIM leader Yahya Abu Halmam, reportedly involved in 2010 murder of an elderly French hostage in Niger. Malik Abu Abdil Karim, a senior fighter with AKIM, and Omar Ould Hamaha, the spokesman for Mali's movement for oneness and jihad in West Africa, Mujao, were also targeted by the rewards program, which will give up to $3 million each for information leading to their arrests. The United States has been increasingly worried about the spread of Islamist groups in Mali and across the vast and lawless Sahel since a military coup ousted the government in Bamako. Former colonial power France has led a military offensive since January against the militants in Mali's northern desert. As the West African nation prepares for presidential elections on July 28th, there are fears, however, that the spread of militant groups risks destabilizing the entire West African region. Trevor Ombija, CCTV.
Well, AfricaLive returns in a moment. We'll take a short break, but when we return,
Chinese medical teams has been of great help because we're taking services, specialist services to the people, and we also have had some breaking ground procedures done in the country.
A helping hand. We focus on Chinese doctors' efforts to improve healthcare services in Botswana.
Breaking news. Global trends. CCTV News brings you stories with the different aspects of Africa in the international content. With our reporters across Africa and all over the world, we'll tell you about the real Africa and how it impacts the world. Africa Live, every day, only on CCTV News.
This is Africa Live with me, Beatrice Marshall, in Nairobi. Now, Botswana's health sector has undergone several reforms, and most notably is the improvement of service delivery, thanks to a team of Chinese doctors and nurses who have been deployed to one of only 2 referral hospitals in the country. The doctors, qualified in different fields, work closely with the local staff, and their expertise has had a huge impact on the quality of healthcare in Botswana.
Early morning at the Princess Marina Hospital in Botswana's capital, Gaborone. A team of doctors is hard at work. But this is not your typical team that you would find in any hospital in Botswana. It is made up of a special group of doctors from China sent here with the sole aim of boosting the hospital's services. Princess Marina is one of only 2 referral hospitals in Botswana. With a bed capacity of 567, it caters to an average of 600 patients per month, making it one of the most popular hospitals in the country. Much of that popularity is attributed to the special team of Chinese doctors working here.
Since we have Chinese medical teams, has been of great help because we're taking services, specialist services to the people, and we also have had some breaking ground procedures done in the country. So this has been really of great help to us, to the country as a whole, not just at Princess Marina.
Some of the new services offered here include acupuncture, a treatment only found at the Princess Marina Hospital and one that is quickly gaining popularity.
I've been here for almost 2 weeks. But since I've been coming here, I'm much better.
But the Chinese team does not offer its services to patients only. From time to time, they offer training to their local colleagues, some even being sent to China for further specialized training. One such beneficiary is Dr. Ramabu.
The Chinese government has got a massive amount of resources. The hospitals were very impressive. They had very clean working theaters that I thought we might want to copy here in Botswana.
But it's not all smooth sailing for the Chinese team. Working in Africa has presented its fair share of challenges.
So language probably the most important challenge. Second is the culture, religion issues. Many health interventions, which is very popular and common in China, probably is not good in the African region because religion issue. You can't ask the question in the way which China is very normal.
Most of these doctors have been forced to leave their families back in China and sometimes go up to a year without visiting them. Like this young couple that came here slightly over a year ago. They have a teenage daughter whom they only talk to on the phone.
Yeah, I miss my daughter, but this is a work. It's as a volunteer, we have to stay here for something that is not for my daughter. So she have to stay my homeland with my father-in-law as my father, like this, yeah.
But their work here is cut out, and so every single day they provide their services to the hundreds of patients who need them. And when not in hospital, the Chinese team comes to this house to unwind. For a few hours each day, they share a meal and perhaps enjoy a game or 2. They even practice their gardening skills.
We just want to kill time.
But their efforts have not gone unnoticed.
We appreciate their presence here. They have helped us when things were at their worst, when we didn't have enough professionals, medical professionals, doctors, nurses, and so on. And they came to our rescue when we needed that most.
Building Africa's capacity and increasing its medical personnel was one of the key issues discussed during this year's International Roundtable on China-Africa Health Cooperation. And Princess Marina Hospital has provided a perfect example of the benefits that Africa stands to gain from this cooperation. Penina Karibe, CCTV in Gaborone, Botswana.
Well, let's stay in Southern Africa for the moment. And while South Africa continues to make headlines for its peacekeeping efforts on the African continent, an ordinary South African community has called on their government to bring the military into their area to help fight crime. South Africa's President Jacob Zuma would not commit to bringing in the army, but he did promise that his government would do everything possible to improve the criminal situation in the township of Eldorado Park near Johannesburg.
The last time South African government ministers came into Eldorado Park, former President Nelson Mandela was still in power. This time President Zuma was flanked by some of his top cabinet ministers. President Zuma came here to this crime-ridden community southwest of Johannesburg after women in the community wrote to him, pleading with him and his government to help them fight the scourge of drugs, which they say is destroying the lives of their children.
The situation is very bad, very bad. The drug laws takes over everything.
And from a mom's perspective, I'm actually scared for my kids to grow up in Eldorado Park, although this is where I grew up.
One of the mothers who had written to President Zuma said she had addressed a letter to him as a father, as well as the father of the South African nation. She told him how desperate she was for help with a drug addict son.
Dad, you can be the symbol for our community, sir. You can restore hope and give us support that we so desperately require to our addicted and runaway kids. We are relying on you to ensure that law enforcement officers and special courts do not dare face the other way every time they have to act against these drug lords and murderous thugs.
The president said he had been shocked to learn of the pain and suffering that drugs had brought to this community.
We must make a beginning here of a decisive move, so that we can clean our country of this problem. We will not be a government if we don't take action here.
Sir, I thank you for coming out today. Dad, this is a painful outcry, a mother's outcry. To my children, I say thank you. To my boy, Kalen, I did not mean to bring you down today, my child. I am using you today to bring hope to so many other children.
We have heard you. We are going to respond to your calls. We are going to act. I'm going to make it a point that I drive this program myself.
President Zuma promised to get back to these people with a special government program to address the drug problem in their community and across the country. And people here have promised to hold him to his word. Renadal Calm, CCTV, Johannesburg.